Hello, I'm Dr. Marcus Masson from the Reconstructive Orthopedic Center in Houston. We'll be conducting a series of therapy videos that we feel are going to be helpful for our patients who, number one, can't come to therapy because of a busy schedule, two, can't afford therapy because of its expense, and three, to complement the formal therapy that they're receiving. And so we feel that this will be very helpful to all our patients and anyone who wants to view them. So before we start in the specific therapy areas, I'd like to first talk about general principles that involve therapy. The topics that we will cover and what you will learn is what is therapy and the types of therapy that exist, the conditions that require therapy, and then modalities used in therapy, and following that, how we manage the insurance carrier in order to optimize patient care. The definition of therapy is fairly simple. It is physical therapy, a medical field that focuses on the physical intervention, rehabilitation, and prevention of patients with impairment from injury or disease, and that results in either pain, decreased function, and that you can see physically with poor movement, flexibility, strength, and stability issues. Now, the goals of therapy are fairly simple. There are four. The first is to find the causative factors that are causing it, and we do this through a history, physical exam, and indicated studies. The next thing is to identify risk factors, not only from the patient side, but the environmental side. Then we want to immediately try to arrest progression, and we do that by eliminating the risk factors and then initiating rehabilitation to reduce pain and improve function. And finally, we'd like to implement a prevention program by education that optimizes their awareness and training and working with safety managers when it's employee related in order to optimize patient outcomes. Now, to identify the causative factors, as a physician, the most important thing is to get a thorough history. And in the history, we get first a patient profile, then we look at the symptoms that they present and try to determine if the symptoms began with or without an injury, because both lead you down a different path. Now, injuries can be a specific mechanism, like a fall or a motor vehicle accident, or it can involve a causative agent, like a chemical or a machine. And these are important to know so that we understand how best to treat the patient based on the mechanism of injury. Now, symptoms and symptom progression, prior treatment, and the current symptoms that they present with, along with their past medical history, is all important to understand prior to instituting a treatment program. Now, once you're done with the history, a physical exam that we perform called a simple test is important, and the simple test evaluates the entire musculoskeletal system. Simple, or S4, starts with S4, stands for patient surface, for the articular surfaces, and then strength for the strength of the patient, stability in the ligamentous structures that hold the joint together, and then the sensory motor function that looks at both sensation and motor nerve activities. Following this, we go to inspection, and inspection is to look and observe symmetry of the patient, any atrophy, scars, tattoos, anything that they may have that indicates something may be contributing to the causative factor. Then motion is examined, and motion is looked for active and passive motion and what we call active-passive discrepancy, because this gives you a whole slew of diagnoses that we can focus on. Leverage special tests is that for each condition there are special tests that we do in order to optimize the diagnosis. And finally, we look at extrinsic causes for anatomic pain, because many times, particularly nerves, can have referred pain that causes this as an indicated problem. Now, studies that we perform, depending on our findings, can include lab work, plain films, MRIs, CT scans, or any diagnostic injections that can localize the problem or area of interest. Once we've identified through the physical exam the mechanical problem that is causing the symptoms, we try to look at the patient's risk factors, and there are individual risk factors that can cause a patient to have injury. For example, a new employee can have a lack of experience and cause an injury from that. It could be poor technique or poor focus because of distraction, or just poor discipline that comes with lack of experience. And then the comorbidities, which is essentially our disease processes or disease-associated elements that can increase risk of injury or can increase risk of disease, are things like smoking and obesity and insulin-dependent diabetes. Now, to identify these risk factors is one thing, but then you have to teach your patient or the employee of how to observe things. And you have to look at both the floor, the ceiling, the machinery that you look for such things as electrical hazards, height hazards, floor hazards, lighting issues, noise issues, or clutter. These all can actually end up in a significant injury. The workstation is evaluated for ergonomic or environmental efficiency of motion, and posture is also looked at. The whole idea between identifying the risk factors is to arrest its progression. We do that by addressing the comorbidities, by getting medical consults or advising the patient to lose weight or smoke cessation, or even to take the proper medications, which sometimes they ignore. And then the environmental hazards are addressed according to which environmental hazards are found. And we look at both equipment, supplies, and instruments, as well as the workflow that can cause an injury. The prevention plan is essentially campaign of awareness with education and training and communication with safety managers and other health professionals that are involved in patient evaluation or employee evaluation and observation. There are also other methods that include softwares that can actually give you visual clues, auditory clues, or even tactile clues that a problem is imminent. Now, there are 3 types of land-based therapy, which includes physical therapy that involves and focuses on motion and primarily the lower extremity. Occupational therapy is essentially functional therapy that looks at the upper extremities primarily, particularly the hands and wrists. And these therapies are specially trained therapists that have certifications that allow them to be an expert in these areas. Finally, there's chiropractic treatment, which essentially focuses on the spine and also uses other therapy modalities, but they focus on manipulation and easing the patient's pain. Finally, there's aquatic therapy, and aquatic therapy is therapy used for total body therapy or therapy that involves low impact based on patient needs. Now, the conditions that require therapy are fairly simple. It includes weakness, stiffness, contractures, swelling from any cause, instability of a joint, balance issues with ambulation, scar sensitivity, pain, and any wounds that can actually cause. Now, looking specifically at each of these, let's talk about weakness. And weakness is essentially something where you have to strengthen. And there are 2 types of muscle groups that you strengthen. There's the white fiber and the red fiber, but each fiber is different. Strength for lifting and pushing and pulling is for power, and that we usually use strengthening individual muscle and muscle groups, and it ends with work hardening if you do heavy work. Endurance, however, involves work conditioning, where you have to hold certain posture and positions for prolonged periods of time. Stiffness, on the other hand, can actually be treated with therapy, but also augmented with ice and heat and stretching exercises, passive motion machines that for the hand or shoulder or elbow exist, and the treatment called fluidotherapy, which active motion can be done in a machine that warms the extremity at the same time. The contractures are a little bit more difficult. It's more than stiffness. It's rigid contractures that require special bracing along with heating and splinting that actually hold positions once you attain it, and the use of ultrasound. And contractures are something that has to be understood when they can be treated. The optimum treatment of contractures are usually within the first 3 to 4 months. After that, it becomes much more difficult, so it's important to identify it early on. The other modalities for swelling include Job stockings, elevation, and any of the dynamic compression boots that decrease swelling. Obviously, the cause of swelling can be many, includes trauma, but also can include diseases that involve the kidneys with hypertension and other medical issues. The balance is different when lower extremity or age come into effect, and the neurovascular system or neuropathic elements come in that make us lose our balance. And so a therapist has to assist you in balancing with devices that can help, like walkers or canes that can assist in your balance. This is important to look at the entire element of the individual, their strength, their endurance, as well as their ability to move on their own. The sensitivity of scars is also a problem because once you have an injury, and there are three mechanisms of injury, there can be a traction injury, a crush injury, or a translational injury, which is called a shear. But whichever type of injury you have, you're injuring tissue. But when you have a wound, primarily through crushing injuries, you can get a scar. And scars can be very sensitive, and the pain of scars limit your motion and can be a significant cause of contractures because what's underneath was also injured. And so scar massage, ultrasound, and motion exercises are indicated for scars. Pain has been treated with many different things besides therapy. Modalities include electrical stimulation, acupuncture, or dry needling for primarily trigger points for myofascial pain. This can be augmented also with medications for muscle relaxants and pain medication. And then wounds are interestingly treated. Depending on the severity of the wound, the stage of the wound, treatment like Whirlpool can be helpful. And we also perform Epsom salt soaks at home that is done twice a day for 30 minutes at one time. Now, therapy, for example, for the shoulder, we have something called a 10-pack shoulder, and we'll be discussing this in the frozen shoulder section and in the section on rotator cuff tears. But essentially, the sequence is very similar. You want to first obtain motion, and motion is done passively, then active assistedly, which then brings in gravity, and then active range of motion, which essentially is an early sign of strengthening because the weight of the limb causes the muscles to fire. And then actual strengthening, typically in particular for the rotator cuff, begins on strengthening at the side to improve the shoulder compressive muscles before overhead strengthening is done. And then finally, you must keep in mind that insurance carriers give you only so much therapy units, and once you use them up, they're gone. And so you must apportion the therapy units according to the diagnosis as they do. And in order to optimize home therapy or therapy units, we supplement this with these videos, which includes home therapy. We educate our patients of how to do home therapy. And we usually do home therapy during the inflammatory healing stage, which is usually between the first 6 to 8 weeks after an injury or a surgery, depending on the condition that's being treated. Now, we start formal therapy when one-to-one formal therapy is required in the guidance of a therapist. And finally, always remember that the home therapy programs in the series we are about to present should be done in conjunction with a formal therapy visit. We'll be talking about handouts and in-office training along with the videos that can help you. So I hope that this understanding of therapy will allow you to know what is available and how to participate for your well-being. I thank you.